right. Well, let's kick things off. So we're here doing our first ever live recorded case study here, and we've got a couple good guests on the docket today. I figure we'll first kind of go around and introduce ourselves. We've got two folks from the partner side, but then also our direct customer side. So if you guys want to quickly introduce yourselves, and we can jump right in.
Yeah, absolutely. I'm Amber Vaughn. I'm the Director of Admissions and Business Development for Asana Recovery.
Yeah, and hi, my name is Tyler Lara Quente. I am the CTO at Rollover Rep.
Awesome. Appreciate you guys. Thanks for joining. So to kind of kick things off here, obviously, Rollover Rep on the partner side, Asana Recovery on the customer side. Amber, when first coming to CTM, what problems, what challenges were you guys looking to solve, and what'd you find at CTM?
Yeah, I mean, initially we were really looking for a call handling solution. We were trying to solve for a completely disorganized call flow. So we had numbers sort of everywhere on landing pages, directories, etc., all of which were being driven to rep cell phones. So there was zero visibility, accountability. We wanted a solution that could organize and streamline our call flow, and also something that was scalable as our organization continued to grow. So we found CTM, and we found that it not only solved for this, but also as we talked to our partners in the industry, seemed to be the industry standard.
And it sounds like a lot of those, you kind of touched on a couple different points there, but a lot of those seem to be, hey, workflow related specific to Asana Recovery. But at a high level, can you kind of touch on some of the maybe challenges or speed bumps just industry wide, right, that you guys are hearing specifically within Asana, but also hearing from patients and new clients that come to you? What are some of those bigger challenges?
Yeah, I mean, one of the biggest challenges in this industry specifically, I think, is its relative infancy. This is a fairly new industry comparatively to others. And what I hear from a lot of other leaders in this space is that they're in the plane, learning how to fly it, and they're building it at the same time. And sometimes that plane is also crashing, and they're doing all of the above. So, that creates a lot of challenges for providers, but also for patients who are trying to navigate, a lack of standards, a lack of professionalism, bumps in the road along the way, for sure. That is what I would say are definitely the biggest challenges in the industry as I see it.
And from the time that you guys see new patients coming in, what does that moment of clarity look like for some of those patients coming in? I mean, I know that's obviously a hard step, and that first step is severely difficult for anybody across a number of different addictions across the board. And I think we saw probably a big jump, since COVID and since the pandemic in 2020, but if not years before that. I mean, what is that moment of clarity from your end? What are patients telling you?
It's unique to each patient in terms of that moment of clarity, but you're exactly right. It takes a tremendous amount of courage to pick up that phone and make that first call. Many would argue that that's the biggest step out of all of them to really getting themselves to a healthy life, and making sure that the individual who picks up that phone, gets to speak with someone who knows how to navigate that call professionally, navigate the challenges the patient's experiencing. And I mean, even worth noting that the call gets answered and doesn't go to a voicemail. It is hugely important. And that changes the direct trajectory of that patient's experience from day one. Their patient journey really starts with that initial call, and that sets the tone for the rest of their experience.
Yeah, and I would imagine it's equally as important for not only just the patient itself, when they're calling, but maybe it's a loved one, right? Maybe it's a friend that's calling in, or a parent or a family member on behalf of that client. So I would imagine that it's similar, whether it be the patient or the loved one calling in.
Yeah, absolutely. We see almost just as many loved ones as patients who are the ones making that initial phone call in. those conversations look different for sure, but the loved ones are certainly seeking education on the experience and what to expect, and they're very pointed questions that the reps have to be prepared to handle.
Sure. So when you guys were looking for, a call tracking solution, obviously there are a number of different providers out there. What stood out, I guess, specifically with call tracking metrics during your evaluation?
Yeah, sure. So we looked at a number of different options. There are other options, but call tracking metrics definitely seemed to be the most user friendly. It connected most seamlessly into our other systems, so the integrations were superior, and really the features, the supportive feature it has. Just to name a few, like the data analytics and the reporting that we get from that. Some of the automations and lead follow-up that we also utilize, those were major contributing factors into our decision as well. And again, and talking to our partners, that just CTM is the standard in our industry.
Fantastic. Yeah. And Amber, so once you guys had implemented CTM, you still obviously had this roadblock solving for missing phone calls. How did that affect your decision to look into a service like Rollover Rep?
Yeah, so we looked at a number of different options to address that issue as well. Different staffing models, virtual versus in-person models, even which hours we prioritized, our staffing. That didn't solve the unavoidable issue that reps are going to miss calls. That's the bottom line. If you have admissions counselors handling the phones and no backup to it, they're going to miss a call. And also we want them to some degree, because admissions take time, and we want to make sure that when the rep is on that conversation, when someone has taken that step to make that call, that they 100% have their attention and aren't worried about, oh man, I just missed 3 calls. I've got to get off this call as soon as possible and get to the next 3. We can rest in that those calls have been handled, expectations have been created, rollover solved for that.
Yeah, it's so important with the complexity of that role in the admissions department to let those individuals focus on what they do best. And it's so easy to think of the calls at 4 a.m. That, obviously no one's manning the phones. And so maybe you're going to miss that one, but really it is those calls during the normal working hours. Seems like you've experienced that too.
Yeah, the majority of calls that Rollover currently covers for us are actually during our manned working hours. So they're overflow calls that our admissions counselors cannot get to. But overnight's great too. Definitely sleep better at night knowing that someone's there to pick up the phone and it's not going to our voicemail, for sure.
Awesome. So if you don't mind me asking, what do your call volumes and your service levels look like?
Yeah, so we average anywhere from 800 to 1,000 inbound calls a month. Outbound is roughly 4 to 5 times that. In terms of service levels, yeah, it's a lot. Service levels, we are full continuum of care. We provide medical detox, residential treatment, partial hospitalization, and intensive outpatient treatment. So full continuum of care for dual diagnosis individuals.
Fantastic. And so I'm curious from your perspective, how is it that you think missed calls affect intake in the industry and specifically at Asana?
Yeah, I mean, ultimately, I know we've said it several times, but it can't be overemphasized. It takes so much courage to make that call. And not only that, but one of the biggest challenges in helping individuals is not just that initial call, but maintaining engagement throughout the process. So for example, at Asana, and what makes our admissions calls longer are that we try and do a 1-call close. There are a number of reasons why we might not be able to get back in touch with a potential patient. There are a lot of circumstantial things, even that this specific demographic might be challenged with. An example that we see rather frequently would be a lot of our patients have a Wi-Fi only phones. So they might stop into like a local McDonald's, plug in their phone to charge it, use free Wi-Fi, Google up treatment, and then they call us. And then if it goes to voicemail or we can't get back to them, it's very difficult to get them back on the phone. So we really work towards a very thorough initial call create the right expectations, and get them in the door as soon as possible while they're motivated and while we can reach them.
Yeah, I so appreciate that focus on the patient journey. I couldn't agree more about how valuable that moment in time is for individuals who are trying to get help. And so when you guys are looking at it, what are maybe some of the metrics you use to measure, how do you value each of these phone calls?
I mean, in terms of value in cost, I think that's what you're asking. I run a cost analysis data model. That's what I'm looking at in terms of cost. And I'm looking at three things. I'm looking at, and CTM helps me identify these, frankly. One is exactly where that call came from, the marketing channel specifically. So let's say pay-per-click or SEO. To my particular spend in a month in that marketing channel, and then the number of calls it produces. So to give you an example, because that sounds pretty vague, let's say I get 1,000 calls this month, right? And roughly 10% of them are pay-per-click. So that's 100. Keep the numbers easy. 100 calls come from pay-per-click. I spend $50K on pay-per-click this month. That means that specific call and every call from that channel cost me $500 for someone to call in. So really, when we're evaluating, our front end sales and marketing teams and the systems and softwares we use to support us, these are very expensive calls to potentially miss. And the solutions are far less of a cost, both financially and human cost. So for us, it was a no-brainer.
Yeah,
with both CTM and Rollover.
And so we know that you guys had that goal. You wanted to get to every single phone call. We know how much they mean and what they're worth as a business. What were the factors that ultimately made you choose Rollover Rep as your solution?
Yeah, I mean, initially we were curious and cautiously optimistic just when trying all new ventures. But Rollover Rep offered a free trial for 30 days, which was a huge asset in evaluating its effectiveness for us and how much we actually used it. Initially, we were kind of hesitant. We were considering possibly bringing on another rep. And then we got the data back from the first 30 days and the cost analysis of that. We were like, okay, this is a no-brainer. I can't believe we didn't do this sooner. And then just listening into the calls after those first 30 days or during those first 30 days, the reps that Rollover Rep uses are industry specific. So they understand the language, they understand the nuance. It is even an added benefit that they're trained. I don't have to hire a staff, train them up, and go through that process. They already know how to do it. So comparatively, the cost was in every way a no-brainer for us.
Yeah, that's part of what I'm curious about. I'm sure you guys were looking at alternatives, including staffing and all that. Was there anything else that stood out to you about Rollover Rep that while you were researching these different options?
I absolutely loved the reporting that I get. It helps me evaluate urgency. So for anybody unfamiliar with it, you get a text message alert as well as an email alert, and it puts it into buckets of admissions call, non-admissions call. And then you get a narrative with each one. So for my team particularly, it was super helpful to immediately have access to understand, okay, I saw the call just came in and we missed it. Rollover Rep picked it up. How important was that call? And do I need anybody to shift priorities immediately? And all I have to do is click a button, look at the email, and I can make a decision. That was a huge added value for us and something that we use every day, all day to make decisions, how we spend our time.
So thinking about CTM, what do you think works particularly well in the crossover between, behavioral healthcare services and the admission services?
Yeah, sure. So a couple of things, but particularly for us, the admissions team development, coaching, accountability, and compliance, that's a huge one as well. Just quality control overall. Specifically for CTM in the behavioral health space and admissions, the crossover between the two. The call recording feature, the ability to drop in and listen to a call, train a rep in real time, help them navigate a call if they get stuck. We even have, built-in flags for keywords of, let's say someone brings up suicidal ideation. I have an alert that draws me into the conversation. I can jump in and help the rep. Really tremendous value in staff training and preparing them to handle those admissions calls in this space.
Awesome. And what about Rollover Rep do you think works well kind of in the same vein?
Well, as we already said, it's solving a major unavoidable issue that I don't know that there is another solution to solve for. You don't miss any calls anymore. That's amazing in of itself. It provides visibility and accountability for when calls are missed. So I have a better understanding of exactly even peak times that my team is missing the calls. Maybe we need to change our staffing, et cetera. But again, that alert and how we're able to prioritize our tasks and prioritize our team's focus is a tremendous value for us.
Awesome. And looking at just the combination between call tracking metrics and rollover rep, obviously you're going to see some efficiencies on the front end with your team internally at Asana, but why don't we kind of touch on a few of those, but then also on the client side, and the patient side, what are the benefits, related to them as well?
Yeah, I mean, for me personally, Rollover Rep and CTM are almost the perfect marriage to solve for the issues that our organization faces in this industry. From CTM, it tells us everything about the call that I need to know, where it came from, who handled it, exactly what happened. It plugs straight into my CRM, and then I can pull, any analytics and data that I need to support my marketing efforts. Tells me how to staff. There's just so much inherent value in all of the data it captures. But again, the reality is we're always going to miss calls. So having that supportive service to come in, pick up the call, and that individual on the patient experience, they've mustered up the courage to make that call. And I can't imagine a worse scenario if I put myself in their shoes of really working yourself up to have the courage to make that call and then getting a voicemail, or even worse, just someone who is completely ill-equipped to navigate that call. And that can do a lot more harm than it does good, even if they do answer the call. So really the combination of both have helped us make sure that our team is highly trained and able to navigate these calls and solve for any training issues that we might have. And then also make sure every single call gets answered all day long, 24/7.
Oh, love to hear it. Love to hear it. So, do you have any specific numbers or any kind of, data, really kind of showing where, CTM and Rollover Rep have helped Asana and your clients at large?
I have a bunch of data from Rollover. I think Tyler has prepared to bring, if I'm not mistaken. But to speak broadly, I regularly compare even the performance, and I'm able to do so because of the data CTM provides me, the performance of my reps versus how rollover reps convert. So if the patient reaches my in-house team or if the patient reaches rollover rep first, how do those two scenarios play out? Are there variances? And really the answer is no. I can expect the same quality of service from Rollover Rep that I do from my in-house team, and they convert about the same to an admission. So it's an absolutely incredible professional service that solves many, many of these issues for us.
Yeah. Suffice it to say, Amber, for Asana, last month we saw something like 150 of your missed calls came through to our call center. Just looking at that over the course of a year for Asana, that can represent millions of dollars in business for your facility.
I think when we reviewed our end of year data, you can correct me if I'm wrong, Tyler, but we were somewhere in the vicinity of over $1 million of revenue.
That's right.
Recovered caught by Rollover Rep that we would have otherwise missed. And re-engagement is not that great. If you miss that call and it goes to voicemail, I'd say conservatively, a measure of success would be like 25% re-engagement, which is not great when that's a $500 call for sure.
Yeah. Wow. And Amber, you touched on a couple of those specific features, functionality, the call recordings, the ability for some of your administrators to kind of drop in on certain calls and keyword spotting. Are there any other, specific feature functionality, within CTM that you potentially recommend other behavioral health addiction treatment facilities like yourself to look into or maybe want to highlight?
I mean, CTM has a number of features that you can use to optimize for really anything you're trying to solve for. I could answer this question a million different ways, but the reality is I would challenge anybody who runs a front end sales and marketing team for behavioral health admissions is to ask yourself, do you know where this call came from? Do you know if it was their first time calling in? Did your rep do well in that call? What could your rep have done differently? And how would you coach them to do better? And then after your rep hung up the phone, what happened to the lead next? Did you capture that anywhere else? Did anybody follow up with that lead? Did they actually admit? Is it in your CRM? Can you see your patient journey experience from touch point 1 all the way to graduation? All of those capabilities are within CTM and are imperative for behavioral health leaders to understand as you're building out your front end teams. And call tracking metrics is capable of doing all of them.
Awesome. And Tyler, this is a question pointed for you. So obviously the relationship with Rollover Rep, I know you guys kind of built an integration on your own, but then, recently you and I connected and started to kind of build out that relationship a little bit more in depth. But, are there any big wins that you guys have seen with clients over there since, kind of building that relationship with CTM?
Yeah, absolutely. And Amber, I'm so glad that you brought up the data and the tracking and the admissions operations side of CTM because it's so big for us from our perspective. We always recommend CTM as the first in class phone provider. And the reason for that is first because when we go to set up, our installation is super simple. It's very reliable, makes it easier for all of our treatment centers just to get started with Rollover Rep. But beyond that, when we see a treatment center working with CTM, we can have faith that those are the treatment centers that are using their data. They're making good decisions based around what's best for their operation. And those are the ones that are our most successful partners. So across the board, and we're working with all different sizes, all different kinds of treatment centers throughout the day. Across the board, we see the most success with CTM.
So I think, the cool thing about this is just hearing from folks like Amber, at Asana Recovery and a lot of the other recovery centers and addiction treatment space, at large is, the impact of missed calls, right? I mean, you can only operate your business for so many hours of the day and only have so much bandwidth. So, we're talking about not only the business side of things and how much those leads are worth, but at the same time we're also talking about someone's life, right? And that big step that those patients are making to call and to seek help, in addition to their loved ones, right? So it's nice to have a trusted partner like Rollover Rep, where we have an integration and it's the largest addiction treatment answering service, that we can solve this problem and hurdle together. So I think that's a big win for both of us.
I think you make a great point just to piggyback off of that for a second. I mean, we talked about the financial cost, but there is a real life human cost to a missed call, especially with the rise of high lethality substances like fentanyl, for example. A missed call could literally be a life or death decision. So like I said earlier, I sleep way better removing that responsibility that we're not going to miss a call. But you have to weigh in the human cost as well, for sure.
Yeah, Amber, I'm glad you mentioned it before, but we've seen it throughout our journey at Rollover Rep that having these dedicated agents who are trained specifically in addiction treatment and behavioral healthcare has made all the difference on these phone calls in these moments for the individuals who are seeking help. And so we're happy, we're grateful every day that we get to provide that service to people who need it.
This is fantastic, guys. And before we kind of wrap things up here, Amber, Tyler, from your perspective, are there any other, questions or maybe just thought leadership or anything for anybody else listening or watching or reading in the space that we can address here?
For me, I would just say, for anybody that is struggling to understand maybe what is broken in their front end systems, what's not working effectively, where maybe they're spending too much money, or they have a bleed in their budget, or they're not converting well enough. There are a number of problems that arise on the front end. I would highly encourage them to consider CTM as a solution to start capturing that crucial data to make those decisions. That's really where it starts. You have to understand exactly what's going on to make a decision. And there's no better way, in my opinion, to do it than with data. And CTM provides that. And then for me personally, I can't imagine anything else that would be a better asset to your team than Rollover Rep. The cost per service versus hiring and training and staffing 24/7 is just very incremental. It's much more affordable to do the Rollover Rep route, and you have the peace of mind of making sure that it never goes unanswered, and they are trained exactly as Tyler said. So, I think those solve two of the biggest issues on the front end that we face in this industry, and I would highly encourage them to consider both. I don't know how anybody does it without it. That's my question. How does anybody do it without it? Well, so.
That's great to hear. Tyler, any final thoughts, and then we can wrap things up here.
I think Amber said it best, and anyone who saw me on the CTM demo day will have heard me say the same things. But I think there are some really simple tips for improving your admissions process, and I think they start with knowing your data and what happens throughout the entire admissions life cycle for each of your admissions. And I think it boils down to making sure you're there when people need help and not missing any of your phone calls.
Well, I appreciate you guys joining. Looking forward to continuing building the relationship and obviously strengthening the partnership with Rollover Rep. So yeah, appreciate it. And you guys have a good rest of the afternoon.
Yeah, thanks for the opportunity, Brian. And always good to talk to you, Tyler.
Thank you, Brian. Thank you, Amber.